6 ways to prevent breast cancer you've probably never heard of. Breast cancer is the most common cancer in women in America. Research has shown that there are many preventable causes of breast cancer. It is essential to take all the necessary steps to lower your risk of developing breast cancer. There are different types of breast cancers, and they can be classified into hormone-related cancers and non-hormone-related cancers. Hormone-related cancers occur when hormones trigger changes in cells that may lead to cancer. Non-hormone-related cancers do not depend on hormones and instead occur spontaneously without a known cause. Women with a family history of breast or ovarian cancer will often get genetic testing. Genetic testing looks for changes in specific genes that may make someone more likely to develop certain diseases such as breast or ovarian cancer. These tests are available for patients at risk of developing breast or ovarian cancer and may benefit women who are experiencing symptoms. In this video, we are going to share with you best ways to prevent breast cancer you've probably never heard of. But before we get started, I'd like to remind you that this video is only for educational and informational purposes, and you should always consult with your doctor before changing your diet or taking any new foods or supplements. If you like this video, don't forget to give it a thumb up and consider subscribing to our channel to receive future videos with more helpful advice and tips. With that out of the way, let's get started. Number 1. Quit smoking. Smoking is a major risk factor for cancer and other health issues. It has been found that smoking is the cause of about 1 in every 5 deaths from cancer. Quitting smoking is one of the most critical steps in preventing breast cancer. Women who smoke are at a higher risk of breast cancer than women who don't. Women who smoke and drink alcohol have an even greater risk of developing breast cancer. Smoking may also affect how well chemotherapy works, so if you are diagnosed with breast cancer, you will need to stop smoking before your treatment begins. The harmful chemicals in cigarettes are toxic to all body parts, including the breasts, and can lead to breast cancer development. Quitting smoking will not only help prevent these cancers, but also improve the quality of life for you and those around you. Number 2. Lose weight. Losing weight is not only good for the waistline, but also for the breasts. The link between obesity and breast cancer is unclear. However, one theory suggests that estrogen levels may be affected by high body fat, leading to higher levels of circulating estrogen in obese people, increasing their risk of developing breast cancer. In another study by the University of Minnesota, researchers found that women who had more fat around their waists and had more body fat in general were at a higher risk of developing breast cancer. Obesity can cause hormone imbalance, which increases your risk of breast cancer. That's why it's a good idea to lose that extra weight to keep your breasts healthy and happy. Number 3. Exercise regularly. Regular exercise has been linked to a lower risk of breast cancer. Exercise helps the body produce more estrogens and reduces the adverse effects of estrogens on breast tissue. For those at an increased risk for breast cancer, such as those with BRCA1 or BRCA2 mutations, regular exercise can be an essential part of managing their risk. Exercise is also essential for those who have had breast cancer treatment. After treatment, the body will often change, and this can cause feelings of fatigue and anemia. Exercise can help by reducing stress and reducing fatigue that comes from not feeling well. There is evidence that it can also help with weight gain after treatment, which happens in many people after they have surgery for breast cancer. The National Cancer Institute suggests that women should get at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic physical activity, spread out over 5 days. Aerobic exercise stimulates normal cell growth in the breast, which can help to lower the risk for breast cancer. Women who are overweight or obese are advised to start with short periods of exercise and gradually increase the intensity. Aerobic exercise is any physical activity that increases your heart rate and makes you breathe faster for an extended period. Number 4. Avoid alcohol. Many people are often unaware that drinking alcohol can increase the risk of developing breast cancer. This is because alcohol changes the way hormones work in your body. There is a direct correlation between the amount of estrogen in your body and breast cancer occurrences. If people drink alcohol, they consume many more calories than they need and can lead to obesity. Alcohol also increases estrogen levels, which increase the risk of breast cancer. Recent studies have shown that drinking alcohol in moderation can help to prevent breast cancer, but there are also certain risks associated with this too. The risk of breast cancer increases if a person drinks more than 3 alcoholic beverages a day, drinks before the age of 40, and has a family history of breast cancer. Number 5. Eat healthy foods. Every woman should know that we can reduce the risk of breast cancer by eating healthy foods. The less sugar and fat we consume, the better our chances of avoiding this disease. Different types of food can reduce breast cancer risk in different ways. For example, soy products have been shown to have a protective effect against breast cancers with estrogen receptor-positive tumors. Another study found that women who consumed more cruciferous vegetables had a lower incidence of breast cancers overall. Furthermore, reducing the consumption of red meat was associated with a lower incidence rate for all types of invasive breast tumors. If you want to reduce your chances of developing breast cancer in the future, it is essential to eat a healthy diet. Eating plenty of vegetables and fruits can help reduce the number of toxins in your body, while also providing antioxidants that protect against free radicals linked to many cancers. Getting enough calcium by eating dairy products can help strengthen bones and prevent osteoporosis, which is linked to increased levels of estrogen, which can increase the risk of developing breast cancer. Number 6. Reduce stress levels. Stress is known to affect many parts of our body, including our immune system, cardiovascular system, hormones, blood pressure, neurological system, etc. One of the most important things that stress does is that it contributes to chronic inflammation in the body, which can cause an imbalance in hormone levels, which may result in high estrogen levels, which is a risk factor for developing breast cancer. Reducing stress levels may help to prevent breast cancer because less stress means a healthier immune system that can fight against diseases like breast cancer. There are many things that you can do to lower your stress level, but here are a few of them. Get plenty of sleep, drink lots of water, and exercise regularly. Try deep breathing exercises, yoga, or mindfulness meditation. Practice mindfulness in your everyday life and surround yourself with supportive people and practice gratitude for what you have. I hope you enjoyed the video, and if you'd want to help us produce more like it, please subscribe to the channel and turn on the bell to get any future videos with more useful health-related tips and information.